Hi, my name is Samantha Klein. I am a senior at Missouri University, and my webinar is over health insurance. Hopefully, it's just a brief overview for information to help individuals. My first work go over all of it. So in this presentation, I'm going to cover health insurance so you're able to identify certain terminology and understand some key concepts of it. And then I will talk about Medicaid, Medicare, and then the last part, I will talk about the Affordable Care Act briefly. First, we need to start with what insurance is and why is health insurance important. So health insurance is important because it is a promise of coverage given to an individual, family, or a group where you are receiving a defined set of healthcare benefits in exchange for paying that premium, either weekly, biweekly, or monthly. The purchase of having that health plan or health coverage helps reduce risks and unpredictability that, especially financially, to help with consumers to help break down those costs as well. So understanding some terminology. So I have come up with certain terms that can help you understand a little better what common terminology that insurance companies use. So when you're looking at insurance, when you're looking at co-insurance is a clause in most insurances that once you have met your deductible for the year, that's the percentage of the bill that you will continue to pay until you've met your out-of-pocket maximum. For an example, if you meet your $2,500 deductible in May, and then your co-insurance would be 20%. If you had a bill that was $100, then you would only pay $20 of that. Next term is deductible. It is what you pay annually for your health services before your insurance company pays its share. Plans often cover costs of things like preventative care, doctor visits, even before you have met that deductible as well. There are high deductible plans as well. That means you are paying a higher deductible than most people, but premiums are at a set amount. So deductibles such as $4,500 is pretty high as well for an individual. Copayment. Copayment is the amount you owe each time you receive certain types of medical care. It is a sharing mechanism. So most insurance companies will tell you if when you go to a preventative or your PCP, your primary care physician, for any visit, it is going to be X amount of dollars. So sometimes your copayment is $20. But when you go to urgent care or the emergency room, you do pay a higher copayment for those visits. We have HMO, which is a health maintenance organization. It's a medical group that provides physicians, hospitals, and clinical services to participating members for a flat fee. These generally give you the flexibility who you can choose as your provider. There is the health savings account, which is also abbreviated as HSA. It allows an individual to put in up to $3,350 in pre-tax dollars to be used for medical expenses. So you can use these funds to pay for visits, medications, anything medically related to you or any of your dependents on your account. Unused HSA funds remain in your account until you need them. Premium. Premium is what you'll pay the insurance company for having this active insurance plan. Some of these premiums can be as low as $67 if it's just an individual, and go much more the more you have dependent wise. Usually most places cap it to families. So it doesn't matter if you have 2 kids or 6 kids, that family cost is all you'll be paying. Out-of-pocket maximum is the amount that you'll pay each year, cost, including your deductible, copay, and co-insurance. Once you've met that maximum, your insurance company will pay for the remainder of your care. So once you've met that out-of-pocket maximum, your services for the remainder of that fiscal year will not be at any charge to you. Point of service. You can't receive care from a specialist without a referral for your main doctor. So when you're looking at health plans, if it says that you have to have a point of service, that means you cannot go to an ears, nose, or throat doctor or an orthopedist without having that referral from your primary care physician. A preferred provider organization, a PPO. Your insurance might pay a portion of your bill if you visit a doctor or specialist outside your network. So this allows you to go more out network. You won't need a referral if you have a PPO to see a specialist at that point. And that's the end of part 1.